Welcome back. If you're a childhood cancer survivor, you have a lot to celebrate, but there are some health risks that can extend into adulthood. Wendy McClellan is here from Children's Mercy to talk about a new conference for adult survivors of childhood cancer. Welcome to the show.
Thank you for having me.
So what are some of the late effects of childhood cancer that you see as adults?
So the survivors could have problems with their heart eventually, problems with fertility, the endocrine system. They can actually have learning problems and some emotional difficulty sometimes.
So why is it so important there's follow-up?
Well, a lot of times these kids don't remember what kind of treatment they had, and they may not realize that they are at risk for late effects later on in life and that they need to continue to get screening. So having that follow-up gives them the opportunity to get the education and know what they need to do to stay healthy.
And when do you say someone is cured of cancer?
Well, that really depends on the kind of cancer. I think the most common number of people are familiar with is 5 years, and that's usually as a result of the leukemia diagnosis. But we use that word cured in different ways, but by the time they come to our program, they are considered cured for the most part.
And what is the Survive and Thrive Clinic at Children's Mercy?
So it's a comprehensive program that provides care to our cancer survivors. We do education, we do screening for late effects, and we also help prepare the survivors to leave Children's Mercy. They will eventually have to go see an adult provider, and we want them to be ready for that.
How do you think the conference will help? This is the first time you're doing it.
Yes.
You're obviously very excited
We are.
and hope that a lot of folks will come out and take advantage of this opportunity.
Yes, so this is the first conference we're doing where we're targeting adult survivors of childhood cancer. So our goal is survivors over the age of 21, and the reason we're doing it is we know they may not have the information. They may not know that they're at risk for health problems, and they may not be getting the care that they need. So we hope to give them information and resources so they can take care of themselves.
So you want them to walk away feeling informed
Yes.
about their
Yes.
health.
Exactly.
Take ownership of their health.
Yes, and to know what they can do if they are having a problem, and to realize it could be related to their cancer treatment many years ago.
And you mentioned emotional.
Yes.
I mean, you don't think about that, but the trauma to your body, not just from the cancer, but from the treatment.
Right.
How do you address that with them?
Well, we want them to know that it's okay if they're having emotional problems, that can happen, especially if they remember some of the things that they went through, and it affects the whole family. So we want them to know that that is real and that there are resources out there for them to get help. So we will talk about that at the conference.
Now, to give us the details on the I Beat Cancer Now What conference.
So this is a conference at the Kaufman Conference Center. We are going to have speakers from Children's Mercy, KU Medical Center, and then a speaker coming in from a nonprofit organization to talk about life insurance and financial issues. We're going to cover heart problems. We're going to cover the recommendations for follow-up, some risks, some general health tips for the survivors, and then we're also going to give them a time to ask questions and to learn more from our speakers.
Now, the conference is free, but they need to register, and there's a deadline coming up. That's April 1st, right?
Yes, it is free, but we do want them to register so we know how many people to expect.
Well, good luck with the conference. I hope that folks will get a lot out of it, and you know that they can also maybe meet other childhood cancer survivors.
Yes, that'll be important. And the registration's on the Children's Mercy website.
All right, we'll try to have a link on our website as well. So thank you for stopping by.
Thank you.